everyone, so let's move towards our today's topic, which is
basically pubis bone is the part of hip bone, like I said, and hip bone. So what is pubis? Pubis basically होता ये कि the two hip bones are connected with each other and they articulate with each other on the medial side. Okay, so on the joining of that bone, on the joining of the two bones, it forms pubic symphysis. And how it forms? Because the end part of the hip bone is basically pubis. So pubis is formed by the fusion of three bones: ilium, ischium and pubis. We have already talked about ilium and ischium. Now we will talk about pubis. Pubis forms the anterior boundary of the obturator foramen, and it consists of body and two ramus. Body consists of three surfaces: anterior surface, which is also known as femoral surface. नंबर 2 इज posterior surface और pelvic surface. यहाँ मैं एक चीज़ आप लोगों को बता दूँ, इस पूरे हिप बोन में pelvic surface की जहाँ जहाँ बात हुई है, pelvic surface स्मूथ होती है. ये कैरेक्टर आपको याद रखना है. ओके, नाउ medial surface और symphysial surface. Medial or symphysial surface will form pubic symphysis. Okay, and it is covered by articular cartilage and it articulates with the another hip bone. Okay, and lateral side, on the lateral side of the pubis, tubercle is present called pubic tubercle. Now we will talk about ramus. There are two ramus: superior ramus and inferior ramus. Superior ramus is from the body of pubis to acetabulum. From the body of pubis to acetabulum, and it is like the broader part and a thick broader part. It consists of three borders and three surfaces. If we remember the three borders, we can easily memorize the three surfaces. So remember three borders: superior, anterior, inferior border. Superior border is also known as pectineal line or pecten pubis. Anterior border is also known as obturator crest, and inferior border forms upper margin of the obturator foramen. Okay, superior border forms from pubic tubercle to posterior part of ischiopubic eminence. Okay, from ischiopubic eminence to pubic tubercle, superior border is present. Anterior border is from pubic tubercle to acetabulum. Okay, so remember now three surfaces. Number 1 surface is pectineal surface, which is between anterior and superior border. So the surface which is present between anterior and inferior surface, anterior and inferior surface is obturator surface, and the last surface is pelvic surface or posterior surface, which is between superior to inferior surface. Okay, and like I said, pelvic surface is always smooth, so remember this. Now inferior ramus, like I told you in the recording of ischium, that it will join with the ischium and form ischiopubic ramus. Okay, so ischium consists of one ramus which will fuse with the inferior ramus of the pubis and form ischiopubic rami. Okay, so this is a very important point. Remember now, what are the attachments on pubic tubercle? Inguinal ligament is present. Pubic crest on the lateral part, it is the origin of rectus abdominis is on the lateral part of the pubic crest. Now surfaces, what are the attachments on the surface of the pubis? Anterior surface is for the origin of adductor longus, gracilis and obturator externus. Posterior surface is for the origin of obturator internus and levator rani. Okay, and medial surface articulate, and it is covered by hyaline articular cartilage, and it form pubic symphysis, and it is connected with the another bone. So remember these important points.
So guys, take care of yourself and study hard, work hard, and good luck. Bye.